Public Affairs Forum of WZTV Fox 17. And now your host, Dr. James Haney.
Thank you and welcome to the show this morning. The topic this morning is blacks and cancer. And to talk about the whole cancer situation this morning is Dr. DrRHardy, who is the head of the Department of Oncology at Meharry Medical College. And Dr. Hardy, let me welcome you to the show this morning.
Thank you very much, Dr. Haney. I'm Robert Hardy, and I'm the Director of Medical Oncology at Meharry Medical College. I'm Associate Professor of Internal Medicine, and I'm also Chief of the Department of Internal Medicine at the Metropolitan General Hospital. I had my formative training in Florida, in South Florida, Miami, Hollywood, where I grew up. Went to the University of South Florida, where I received my Bachelor's of Science degree in zoology. Then I graduated from Meharry Medical College, receiving the MD degree. Following that, I did my internal medicine residency at Yale, New Haven, Connecticut, and my fellowship in medical oncology at the University of Southern California in Los Angeles, California.
Very good. And so, Dr. Hardy, you've had quite an educational background dealing with this whole issue of cancer and medicine and whatnot, have you not? Dr. Hardy, let's look at some of the things. You know, I think a lot of folks are aware of the whole question of cancer. I don't think that anything can happen today without people thinking about some of the possibilities of catching this disease. Let's talk about cancer as a disease. What is cancer?
Cancer is a group of diseases which is caused by unrestrained growth of abnormal, or what we call transformed cells. These cells are originally derived from parent cells which are normal but which have some change in their genetic makeup. By some reason, possibly secondary to factors related to, say, cancer-causing agents or viruses or radiation and so forth. And these cells then have the ability to grow and not to die. And they continue to grow, and they displace or destroy normal cells and tissues. They metastasize or spread from the local site to distant sites where they cause damage to the body, and ultimately the demise of the patient if this process is not stopped. Cancer has been known since antiquity, and it has been found and discovered to greater degrees as time has progressed, because of the increase in life expectancy of the populations of the world, especially of the Western world, and also because there are probably factors in our diet, behavior, environment, and so forth, which have increased the rate of occurrence or incidence of cancer.
And so, in reality, as you've indicated, cancer is something that is almost as old as mankind.
That's correct.
But now, it does seem that only recently we have become much more aware of it. Is it possible that at other times in our history, in our medical history, that we didn't identify whatever the disease that might have existed as cancer? Why don't you talk about that? That is, how we have viewed this as a disease.
Well, as I said before, in antiquity and prior to this century, most people tended to die, or a large proportion of the population died in younger ages, and they died from infectious diseases of various kinds. And except for the last decade with the advent of AIDS, infectious diseases as a cause of mortality or death had declined greatly in most of the developing countries, and therefore the population lived to be older, and patients tended to have a greater amount of cancer. In addition to that, instruments for the detection and the treatment of various kinds of diseases have progressed or have been developed over the past century, and this has allowed us to better detect cancers, to learn about the histology of disease, and to become much more informed about the causes and the different types of diseases.
Now, you've indicated that you're the head of the Department of Oncology at Meharry. Now, exactly what does that include, and how does that fit into the entire cancer mode?
Okay. Cancer can be controlled by either preventing the cancer if one knows what the cause of it is, as in the case of lung cancer and cigarette smoking, and to a large degree. One could also discover the cancer early and cure it at a time when it's most curable, as is the case with cervical cancer, where you have a tool for early detection and which is very effective. And in some other instances, it might be necessary to detect the cancer, or maybe later, but you still might have modes of therapy or treatment. And these forms of treatment include surgery, chemotherapy or cancer-killing drugs, and radiation therapy. And added to that, we have newer modes of therapy, which include biological agents and etc., which have not been a part of our armamentarium in the past. My specific area has to do with medical oncology, which utilizes primarily drug therapy or cancer chemotherapy for the treatment of these patients in conjunction with other oncologists in the area of radiation oncology and in the area of surgery or surgical oncology. So we use all of these modalities together in order to attempt to eradicate cancers and cure patients.
Let's look at the